So once you're welcome in, we speak to you about whatever concerns you may have, and then what we do is we give you a welcoming packet. Inside the welcoming packet is a sheet that explains some basic information about the hospital, like safety and housekeeping. It is very important for us in the hospital that everyone who works there washes their hands frequently before and after they see each patient. We also encourage patients to wash their hands frequently as well to avoid spreading germs and developing bacteria. Another thing we discuss is the meal times and diet, because we want patients to know when to expect their meals for breakfast, lunch, and dinner. Normally, breakfast will be served at about 8 a.m. Lunch is served at about 12 in the afternoon, and dinner is served at about 5 p.m. Because a lot of patients tend to complain that their food didn't come in on time, they've waited 10 minutes, where's my food? It's been 15 minutes, and we kind of have to tell them ahead of time. It takes a little bit of a while, maybe about a half hour, because it's a big hospital, and we're going to each room, bringing every patient their food. So we want them to know that they are not forgotten, and that we really care for their needs, and we want to make sure that they eat at the time that they should. Another thing we have in the welcoming packet, it explains about the TV and telephone usage. Patients, when they're inpatients and they stay in the hospital, they have TVs in each room and a telephone in each room. Unfortunately, they have to pay for their own TV service and telephone service. So we have to warn them again ahead of time that these are things that they might have to pay for, because they might get upset, and we really want to make sure that we meet their needs. Unfortunately, it's $5 per day for each, the television and the telephone. Sometimes as a courtesy, like if a patient is in ICU, which is the intensive care unit, they don't pay for the telephone or TV. They actually get it for free, which really doesn't sometimes make sense, because a lot of the times they might be comatose and they won't need to use it, but the families that come and stay with them are able to use it, which is unfortunate. Another thing we discuss is the visiting hours. That's another topic that comes up with new patients. They want to know when their families can come in, how many can come in, and at what time. So visiting hours, we tell them, is from 12 to 7 o'clock. Sometimes we make an exception again for patients who are in ICU, that their family members could stay there overnight, like a parent or loved one. We don't allow children in any of the units who are under the age of 14, because we don't want to risk the children spreading germs to the patients or the patients getting the children sick. We also discussed the financing. My hospital is a HHC hospital, which means that we provide our services for free, so they say. We normally, if a patient does not have insurance, we have them apply for Medicaid, or what is now called Obamacare. So that way, their stay there would be paid for. And what happens is that instead of the patient going to billings, we have someone who goes into the patient's room to discuss their insurances, and that way they don't have to go out their way of coming back at another time. Everything is done once they're inpatient. We discuss also the discharging process once a patient leaves. We tell them what to expect, that the team discusses what it is that would be best for them, what medications that they would have to be taking, and the nursing staff would also inform them of if any mishaps comes, like if you get a fever, if you feel worsened, you can always come back into the facility. Okay, so we really want to make sure that patients understand that, because sometimes they leave and they say, no, nobody told me what the plan is with discharge, when normally we have them sign a form stating that it was explained to them as to why they were discharged and the proper what ifs in place, so that they can come back and be educated on it. Now what our goal is is to make patients as comfortable as we can. We really want to make sure that we answer all of their questions. We really want them to know that the least of their worries should be food, should be insurance, should be their family. The more comfortable they are, the better it is for them to heal and go home, because that is the goal. These patients come in to get better and go home. And if we can fasten that process, that would be great. And that's all.